All right, we're going to talk just a little bit. I wanted to interview you per se, just to get a feel from you. How did you get in here? What you've experienced along the way? What's helped you? What are some of the hurdles you still kind of have to go through? Maybe just get a little background how you ended up here to begin with.
So I am a nurse, and with our profession, a lot of back problems. I was recommended to you probably 10 years ago or more. I had neck surgery 24 years ago. Was always told I was never been able to be adjusted till I met you, and you said that was probably misinformation from that long ago. So kind of got here to, I was unable really to even touch my chin to my chest. I couldn't really look side to side laterally. So
because you had some level of fusion done on your spine in that surgery, which was from a car accident that had happened at that age of 18 on there. What have you experienced? What have been some of the benefits since you started?
Since starting, I can now obviously have range of motion. I can move my neck. I used to have lots of numbness and tingling in my left arm, just from the from the surgery. That's all gone mostly away. I don't ever have headaches, don't have any pain, except for when I do get misaligned just because of my...
What things did you, prior to getting better, what things did you do, or excuse me, what things did you avoid because you knew that would probably cause problems? Or were there things that you kind of had to modify?
I really just never did any range of motion. I was always told that just to always move my whole body and not really move my neck, and never to do extensions, never to do flexion.
Interesting.
I was just always told that the way it was fused, that's how my neck would always be.
Because I feel like you've gained some confidence in movement over the course of time. Like the fear of screwing something up is way less. And even with what we've done with you, we've been able to do most normal things with you from a chiropractic perspective, and you've responded pretty well. You obviously do every once in a while have some valleys you get yourself into. Kind of explain some of the things that set you off.
So really, I think with my profession and, the hard work of that, being a bedside nurse and then charting. So then I find myself kind of getting slumped in, postural stuff. Just have to really remind myself to sit back. Now knowing that I need to do those extensions and do stuff outside of the chiropractic office has really helped. Just to make sure that everything stays good.
And I think that's where we've kind of, with you, we're not going to fix what has happened in the past. And by that I simply mean you've had surgery, they fused certain things, that doesn't get undone. Your window for error is so much less now it's less than what some of your age should be, something like that. Our goal is how do we give you a little more room for error, so the things you do don't set you off quite as much on that regards of it. What from a importance perspective, how does this fit in? You're obviously doing chiropractic, you're doing massage therapy consistently as well too. What else are you doing?
Staying active, I think is the biggest thing too, not letting this limit my activity, still doing any activity I wanted to do, because I think you've explained it to me in the past, don't change what I'm doing because we want to fix it and keep it aligned with the activities that I do.
Correct.
Like exercise-wise or riding a bike or anything like that. You don't want to stop doing those things because we want to fix what's happening.
Correct.
While we're doing activity.
Yeah, absolutely. We're not going to completely adjust your lifestyle just to out of caution per se. We have to realize this is reality as well. So we're going to talk a little bit about kind of what we saw when we first saw her right off the bat. And her lower neck is what had the injury from the accident, and they fused as well too. Therefore, when that lower neck gets fused, it puts a lot of strain on the upper neck, so a lot of people end up with headaches. And she described poor range of motion. You were probably less than 20% normal. Most people can get to about anywhere from about 70 to 80 degrees of normal range of motion in terms of rotation. They get to about 45 degrees of lateral flexion on both sides and extension. Go ahead and extend your head back as far as you can through there. You barely could get past flat there to begin with, so bring that back down to normal there. So a lot of what we focused on with her was lower cervical spine, upper thoracic spine, so upper back stuff. The area that doesn't move is never going to move. So we're not going to spend a lot of time there, nor do we want to be adjusting into surgically repaired areas on there. that's a concern so many people have with regards to post-operative issues is, can chiropractic hurt me? And you heard that yourself as well too, so therefore people steer clear. There's a lot of ways to do it. There's not just what you see on YouTube videos and kung fu movies in regards to chiropractic care. Like there's very specific low force, traction oriented type movements we can do. We can use tools that we use as well too with it. But our focus is through here. Our focus is the upper neck, and we want to create more mobility to that middle part of our spine, just so that way we can actually get more motion back to your spine as a whole, so there's not so much tension being put on that one area that's on there. So go ahead and turn your head to the right as far as you can. Yeah, I mean, you're getting a good solid 50 degrees to 60 degrees out of there. Go back to the middle. Go back to your left now. Good. A little bit tougher that way. And your left's always been your problem child as well too. Go back to the center there. Tip your head to the right. Good. Back to the left there. Good. Okay, back to the middle. So the thing we've had with her, and today was a perfect example, so I wanted to do this. She's had a little bit more numbness, tingling down her left arm that's kind of randomly showing back up. So the questions I ask her is like, what are you doing lately? Are the things that are setting some of this stuff off, and the postural stuff, the work schedule, not sleeping in your own bed, too much vacation time, too much NCAA basketball tournament time. These things come back up. To say that what we do is going to fix something permanently on there is crazy. It's no different than if you go and lose 50 pounds at the gym and then you go back to the same habits you had before, you're going to gain it back. You've got to do the little things consistently in here and outside of here as well too with it. So chiropractic is a great tool to help create some movement in the right direction. And I think the moral of this story is just from a post-surgical perspective, like don't wait. I think if there's one thing you probably go back and tell your old self was do this sooner.
Absolutely.
In regards to that part, because you get less scar tissue and less permanent damage that adds up over that course of time. But you've done great. I think the thing we continue to emphasize with you and anybody else that's in here, no matter what they're in here for, do the stuff at home, outside of here, type of thing. Watch your posture, create more movement, do the little exercises that go a long way. Chiropractic works a hell of a lot better when you do those things with it too. So thanks for your time.
Yeah.